Hi, everybody. We're jumping into 5.5 treatments of disorders. So we've learned all the disorders that we need to know for AP Psych. Now we're going to evaluate all of the different types of treatments. And you need to be able to link the treatments to the 7 psychological perspectives. So let's jump in. This might come as a two-parter, or we might try to knock it out all at once. Here we go. Deinstitutionalization. So the old way to deal with people with mental disorders was to lock them up in what are called asylums, without refuge, a place of no home, no shelter, no refuge, asylum. So when someone had a mental disorder in the past, we would just kind of like hide them away from the rest of society and put them in asylums where they would just stay for the most part for way too long or until they died. It was a terrible place. Lots of yeah, just terrible living conditions, famously. I'm sure some of them were okay. But generally, asylums were a terrible place to be. And sometime in, I don't know, I want to say the 1960s or so, they began closing down asylums and society, at least Western society, I'm not sure about the East, began to shut down all of their asylums, and they took a different approach to people with mental illness. Instead of locking them away, we tried to help them overcome their illness. All right. And so all of the things that we're going to learn in 5.5 are ways that we treat mental illnesses today. So the evidence shows that there are a lot of good treatments for mental disorders, and some of them are more effective with treating one disorder, and some of them are more effective with treating another disorder. So we need to be able to distinguish what those are. We will learn in depth what CBT is. This is famously the most effective treatment for almost any disorder. Cognitive behavioral therapy. So it's a combination of the cognitive approach and the behavioral approach because you're trying to get someone to retrain their brain and restructure the way that they think, changing negative thought patterns into positive ones, and also trying to change their behavior. So when they're like change the way that they behave, right? A lot of people uh, behave in ways that make the illness worse or make the symptoms of the illness more apparent, and cognitive behavioral tries to train you to think differently, but also act differently. And it's highly effective for depression, anxiety, PTSD, and OCD. Then there's exposure therapy, and this is highly effective for people with phobias or PTSD. Probably not so much OCD as much as CBT, but exposure therapy is when someone is scared of something, for example, like a phobia or PTSD, there's underlying fear. You want to gradually expose the person to the thing that they're afraid of so that they're less and less afraid of it. So we'll go into that in more detail later, and we'll go into IPT. The therapeutic alliance is just a vocab word that you need to know, and it's just the collaborative alliance between the therapist and the patient, a trusting relationship. In order to really get help and overcome a disorder, somebody with a disorder will need to have somebody very trusted, a therapist that they trust and have an honest relationship with. That's called the therapeutic alliance. Cultural humility involves ongoing process of self-reflection and learning about a client's cultural background, recognizing and addressing power imbalances, and fostering respectful, culturally sensitive therapeutic relationships. Basically, just because in the past and in modern times, there are studies that show therapists have kind of a cultural bias towards, a white American viewpoint, and there's a push these days in psychology to be a little more show a little more cultural humility when you're dealing with people from other cultures because people from other cultures are different. So this is kind of a socio-cultural approach, right? It's like people from other cultures are different. They might act and think in ways that are unusual to, a white American that is telling them what norms are, and normal for one culture might be abnormal for another culture. So therapists should have cultural humility. Non-malfeasance. Non-malfeasance. The ethical principle of do no harm. Right. So we've already learned the ethical principles. Protection from harm is one of them, and that's just kind of what non-malfeasance means. Therapists should avoid actions or interventions that could cause physical, emotional, or psychological harm to their clients. So therapists really shouldn't ever advise a client to do anything that could be even emotionally harmful. They're very careful. Or they should be very careful if they're practicing non-malfeasance. Fidelity, another ethical principle of maintaining trust, honesty, and commitment to the therapeutic relationship, ensuring reliability and integrity of professional conduct. So therapists have to use fidelity. They have to be open and honest and trusting and committed to the patient. Integrity, I mean, these are all kind of the same thing, and highly unlikely that any of these words are going to appear on an AP exam. These will not be differentiated on a test, integrity versus fidelity. You won't see these on any kind of AP exam. I'm 99.9% sure. Respect for people's rights and dignity, yet another one, just kind of like the cultural thing. We need to recognize and honor the inherent worth of all individuals, ensuring privacy, confidentiality, and self-determination, and treating clients with fairness and respect in clinical psychology. Same thing, not going to be on any kind of AP exam. But here we go. This is something that will be on the AP exam. Psychodynamic therapies. So this got hot kind of in the early 1900s and lasted through the 1960s, where it was probably like the golden age of psychodynamic therapy before the cognitive revolution. And a psychodynamic therapy is basically you're trying to hack into the client's subconscious and unconscious minds, right? You're asking them about their past, right? Maybe, your father is the reason why you have social anxiety disorder. Maybe growing up, uh, your parents did certain things, or you had a bad experience giving a speech in front of the whole school. And these traumas may be influencing your current anxiety, right? So that a psychodynamic therapist tries to get the patient to realize their underlying causes for their negative thinking patterns or their maladaptive behaviors, and they try to course correct. Once you realize why you're sad or why you're afraid of spiders or why you're anxious around large groups of people, then we can address it and cure it. Psychodynamic therapy tries to get the client to see what's hiding beneath the surface of their brain. So one method that psychodynamic psychologists use is called free association, and that's when you just get the patient to talk without thinking. It's just like, talk to me. What's on your mind? Now that's very difficult because usually when somebody asks us to talk, we think and then talk, right? We want to make sure we say the right thing and we don't embarrass ourselves. Free association is when you're talking without stopping to think about it. You're just thinking and talking simultaneously. So you can really get at the answer as a psychologist, right? If the person is just talking and their ego defense mechanisms aren't up, they're just willing to share what's on their mind freely, then the psychologist can more easily kind of tap into their subconscious and unconscious mind, free association. Another thing that psychodynamic psychologists and therapists do is dream interpretation. The psychodynamic perspective is big on dreams because they think dreams come from your unconscious mind or your subconscious, and they represent some real anxiety that you have about daily life. So if you have a weird dream, a psychodynamic psychologist would very much want to hear about it and analyze it and see if your dream represents something that you're actually afraid of or anxious about, that your conscious mind isn't really aware of. Your dreams are trying to tell you something, something bad, or something bad is coming, or something bad is about to happen, or something in your life is messed up. And psychodynamic psychologists interpret these dreams to try to, again, tap into the subconscious and unconscious and help the patient realize it. Now, this is not psychodynamic. Person-centered therapy is going to be a humanistic approach. This is guaranteed to be on the AP exam, like matching the approaches with the therapies. It's extremely important. Person-centered therapy is a humanistic approach, which makes sense because the person-centered therapist provides support where clients can achieve basically working their way up Maslow's hierarchy of needs, a supportive environment where clients can achieve self-discovery, personal growth. Anytime you see the word growth, it's going to be humanistic approach. Unconditional positive regard, we'll talk about in a second. So person-centered therapy, you're just there to support the person and help them work their way up the pyramid. A therapist from the humanistic approach uses active listening. And you can probably guess what active listening means, right? It's really listening, really, really listening. You're not just going through the motions of barely listening like we usually are. Like when someone's usually talking to us, we're usually not active, right? We're looking at our phone or we're thinking about something else or we're thinking about the next thing that we're going to say. Active listening is true listening, and a good therapist is good at active listening, and a good student is good at active listening. Unconditional positive regard, another humanistic term. Make sure you got this, humanistic. Unconditional positive regard. So the therapist should hold the patient in positive regard. They should treat them positively, unconditionally, right? Even if the patient has committed some crime, or even if the patient has committed a serious crime, or is weird, or does something disgusting, you still want to treat them with love and affection and positivity, because that's really the only way that you're going to create change from the humanistic approach, right? You cannot be negative on your patients. You got to just kill them with kindness, and you've got to show them as much love as you would want to be shown. That's called unconditional positive regard. And yeah, and the last thing is you just need to differentiate between group therapy and individual therapy. Again, these are things that the definition, like the word speaks for the definition. Group therapy is conducted in a group, and sometimes group therapy is more effective because you have other people there that share the same experience that you're going through, right? If you're depressed or anxious and there are other depressed or anxious people there, it might be more comfortable for you to share, it might be more comfortable for you to talk, feel less isolated. You got diverse perspectives. The disadvantages is you get less attention to yourself and it's kind of discomfort sharing with other people. Group therapy can be beneficial, and individual therapy is probably a lot more common because people are scared of group therapy. They'd rather do individual therapy, one-on-one, personal issues, individualized treatment. It's better for many reasons. However, it's costly. I guess it's more expensive, and lack of social support. You know, as humans, we need that social support. Might be helpful if you have social anxiety and you're meeting with other people that have social anxiety, so you can support each other and share strategies to overcome it. And that is a wrap for that one. Thank you for listening. I'll see you for the next one. Bye bye.